Starting with the medial aspect bony landmarks of the ankle, we have the first metatarsal cuneiform joint. First, find the head of the first metatarsal. It begins to flare at its base where the first cuneiform bone projects. Moving proximally along the medial border, the next large bony prominence is the navicular tubercle. The navicular articulates distally with the three cuneiforms and laterally with the cuboid bone. The head of talus is immediately proximal to the navicular tubercle. Everting the forefoot causes the head of the talus to jut out. To find the medial malleolus, move proximally to the distal end of the tibia. Move plantarward about 2 centimeters from the distal end of the medial malleolus is the sustentaculum tali. It is small and serves as the attachment of the spring ligament. Barely palpable immediately posterior to the distal end of the malleolus is the medial tubercle of the talus. The fifth metatarsal bone on the lateral side of the ball of the foot is usually the most prominent. The styloid process of the fifth metatarsal move laterally on the head of the fifth and palpate the protrusion. This is also the insertion site of the peroneus brevis. Moving proximally along the foot's lateral border, the posterior portion is the calcaneus. On the calcaneus distal to the lateral malleolus, the peroneal tubercle separates the peroneus brevis and longus tendons. To find the lateral malleolus, it is located on the distal end of the tibia on the lateral side. Now we'll palpate the sinus tarsi area bony landmarks. To find the sinus tarsi, stabilize patient's foot by grasping the calcaneus and place thumb of free hand in the depression anterior to the lateral malleolus. To find the dome of the talus, invert and plantar flex the foot. A small portion of the dome becomes palpable, more palpable on the lateral side. To find the inferior tibiofibular joint, it is located proximal to the talus, and you can't palpate the joint itself, but you can palpate a slight depression over it. Now for the area of the hind foot. Dome of the calcaneus is the bare posterior third of the dome and protrudes from behind the ankle joint. If you begin at the malleoli and move plantarward and posteriorly, the protruding bone is the calcaneus. The superior portion of the bone that protrudes is the dome of the calcaneus. To find the medial tubercle of the calcaneus, it lies on the medial plantar surface of the calcaneus. It is broad and rather large, providing an attachment site for the abductor hallucis muscle medially and the flexor digitorum brevis and plantar aponeurosis anteriorly. For the plantar surface bony landmarks, the sesamoid bones are the longitudinal arch past the base of the first metatarsal bone to the first metaphalangeal joint. If you press firmly, you may feel 2 small bones. To find the metatarsal bones, place thumb on the plantar surface and your index finger on the dorsal surface. The metatarsal bones are directly behind the transverse arch of the forefoot. Now for the medial malleolus. The deltoid ligament is the medial collateral ligament of the ankle joint, just inferior to the medial malleolus. It is broad and strong, but not easy to palpate. From the medial malleolus, palpate the soft tissue depression between its posterior aspect and the Achilles tendon. This structure is the most anterior to palpate. This is the tibialis posterior tendon. The flexor digitorum longus tendon is just behind the tibialis posterior tendon and slightly above the malleolus. However, it is generally only felt closer to the plantar surface of the foot. The flexor hallucis longus tendon cannot be palpated unless symptomatic. It runs along the posterior aspect of the tibia and grooves the posterior aspect of the talus. For the posterior tibial artery, it is located between the tendons of the flexor digitorum longus and the flexor hallucis longus. The foot should be relaxed and non-weight bearing. The tibial nerve is located posterior and lateral to the posterior tibial artery. It is difficult to palpate unless symptomatic. Now for the dorsum of the foot between the malleoli. First is the tibialis anterior tendon. It's the most prominent, most medial of the 3 tendons. Instruct the patient to dorsiflex and invert the foot against resistance, palpating distally to its insertion on the medial aspect of the base of the first metatarsal and first cuneiform bones. The extensor hallucis longus tendon is immediately lateral to the tibialis anterior tendon. Instruct patient to actively extend the great toe. Palpate it along the dorsum of the foot to its insertion into the base of the distal phalange of the big toe. Extensor digitorum longus tendon lies lateral to the extensor hallucis longus. Palpate it first where it crosses the ankle joint. Have patient extend toes and then palpate the tendon as it splits into 4 parts to the distal phalange of each of the lesser toes. The dorsal pedal artery lies between the extensor hallucis longus and the dorsum of the foot. It's absent 12 to 15% of the time. Now for the lateral malleolus region. The anterior talofibular ligament runs from the anterior portion of the lateral malleolus to the lateral aspect of the talar neck. It is most easily palpated in the sinus tarsi. The calcaneofibular ligament stretches plantarward to the lateral wall of the calcaneus. Posterior talofibular ligament originates on the posterior edge of the lateral malleolus. It is the small tubercle on the calcaneus on the posterior aspect of the talus. This prevents slippage of the fibula onto the talus. For peroneus longus and brevis tendons, pass behind the lateral malleolus as they cross the ankle joint. Have patient actively evert and plantar flex their foot and continue to palpate the brevis to the peroneal tubercle. The peroneus longus is difficult to see, but you will notice one thick tendon and a split. The tendon that runs plantarward can briefly be seen, and that is the peroneus longus. Onto the calcaneus region. The retrocalcaneal bursa lies between the anterior surface of the Achilles tendon and the bare posterior superior angle of the calcaneus. Start at the Achilles tendon and palpate down. Then once you get to the calcaneus, you will be pinching the retrocalcaneal bursa. The calcaneal bursa, moving your finger outward, superficially, it is between the Achilles tendon and the overlying skin. For the plantar surface of the foot, the plantar aponeurosis, or the plantar fascia, originates on the medial tuberosity of the calcaneus and splays out to each of the toes. By palpating the plantar aspect of the foot, beginning at the calcaneus tuberosity, you should feel a large, smooth, and non-nodular surface. Extension of the toes causes the plantar fascia to be more prominent.